Welcome to Diabtron, your digital hub for all things diabetes. The liver is a vital organ in the human body with a wide range of functions. It is located in the upper right side of the abdomen, just beneath the diaphragm. The liver is the largest internal organ in the human body. It is roughly triangular in shape and has two main lobes, the right lobe and the left lobe. The right lobe is larger and further divided into the anterior and posterior segments. The left lobe is smaller and consists of the medial and lateral segments. The liver receives blood from two main sources, the hepatic artery and the portal vein. The hepatic artery supplies oxygenated blood, while the portal vein carries nutrient-rich blood from the digestive organs. The liver is connected to the gallbladder and bile ducts. The gallbladder stores bile produced by the liver, and the bile ducts transport bile to the small intestine to aid in digestion. The liver is composed of specialized cells called hepatocytes, which perform various metabolic functions. Hepatocytes are arranged in lobules, which are the functional units of the liver. Sinusoids are blood vessels within the liver that allow blood to flow through the tissue. These vessels are lined with hepatocytes and are essential for the exchange of nutrients, waste products, and other substances. The biliary system includes the bile ducts, which transport bile from the liver to the gallbladder and small intestine. Bile produced by the liver plays a crucial role in digestion and the absorption of fats. The liver is responsible for detoxifying harmful substances such as drugs and toxins, making them less harmful or preparing them for excretion. The liver is involved in various metabolic processes, including the synthesis of proteins, storage of glycogen, and regulation of glucose levels in the blood. The liver is a multifunctional organ with a wide range of crucial roles in maintaining overall health and homeostasis. It is central to metabolic processes, including the conversion of nutrients from the digestive system into forms that can be used by the body. It metabolizes carbohydrates, fats, and proteins, detoxifies the blood by breaking down and eliminating various toxins, drugs, and metabolic waste products. The liver synthesizes a variety of proteins, including blood-clotting factors such as fibrinogen, albumin, which helps maintain blood volume and pressure, and enzymes involved in various metabolic processes. The liver stores and releases glucose as needed to help regulate blood sugar levels. It also stores certain vitamins, such as vitamin B12 and vitamin D, and minerals. Produces bile, a digestive fluid that is stored in the gallbladder. Bile is released into the small intestine to aid in the digestion and absorption of fats. It regulates cholesterol levels by producing and excreting cholesterol as needed. The liver is also involved in immune function, helping to remove bacteria from the bloodstream and participating in the body's defense against infections. The liver produces clotting factors that are essential for blood coagulation and wound healing. It stores glucose in the form of glycogen, releasing it into the bloodstream when needed for energy. Filters and processes blood coming from the digestive organs through the portal vein, removing and processing nutrients before the blood is circulated to the rest of the body. So let's talk about fatty liver. What is fatty liver? Fatty liver, also known as hepatic steatosis, is a condition characterized by the accumulation of fat in the liver cells. The excessive accumulation of fat can interfere with the normal functioning of the liver. There are two main types of fatty liver. Non-alcoholic fatty liver disease, NAFLD. This is the most common form of fatty liver and is not associated with excessive alcohol consumption. NAFLD is often linked to obesity, insulin resistance, type 2 diabetes, high blood pressure, and high cholesterol levels. In its milder form, NAFLD may not cause noticeable symptoms and is often discovered incidentally during medical tests for other conditions. Alcoholic fatty liver disease, AFLD. This type of fatty liver is associated with excessive alcohol consumption. AFLD can progress from alcoholic fatty liver to more severe conditions, such as alcoholic hepatitis and eventually cirrhosis, if alcohol consumption continues. The exact cause of NAFLD is not fully understood, but it is often associated with metabolic factors such as obesity, insulin resistance, and high levels of fat in the blood, while AFLD and excessive alcohol consumption is the primary cause of AFLD. The liver metabolizes alcohol, and chronic alcohol use can lead to the accumulation of fat in liver cells. In its early stages, fatty liver may not cause noticeable symptoms. As the condition progresses, symptoms may include fatigue, weakness, abdominal pain or discomfort, and weight loss. Fatty liver is often diagnosed through imaging studies such as ultrasound, CT scan, or MRI. Blood tests and liver function tests may also be conducted. Treatment involves addressing the underlying causes. For NAFLD, lifestyle modifications such as weight loss, a healthy diet, and increased physical activity are typically recommended. For AFLD, the primary intervention is the cessation of alcohol consumption. Fatty liver is a reversible condition, especially in its early stages, with appropriate lifestyle changes. However, if left untreated, it can progress to more severe liver diseases, such as cirrhosis. So what's the relationship between diabetes and the fatty liver? The relationship between diabetes and fatty liver is complex and bidirectional. There is a strong association between the two conditions, and they often coexist. Each condition can contribute to the development and progression of the other. Let's explore this relationship. Insulin resistance. Insulin resistance is a key factor linking diabetes and fatty liver. In both type 2 diabetes and non-alcoholic fatty liver disease, NAFLD, there is often an underlying insulin resistance. Insulin resistance impairs the ability of cells to respond to insulin, a hormone that plays a crucial role in glucose regulation. This resistance can lead to elevated blood sugar levels, contributing to the development of diabetes. Type 2 diabetes and NAFLD. Individuals with type 2 diabetes are more likely to develop NAFLD. The insulin resistance associated with diabetes can contribute to the accumulation of fat in the liver. Conversely, the presence of NAFLD can worsen insulin resistance, potentially exacerbating diabetes. Shared risk factors. Diabetes and NAFLD share common risk factors, such as obesity, metabolic syndrome, and high levels of circulating fats, triglycerides. These shared risk factors contribute to the development of both conditions. Inflammation and oxidative stress. Both diabetes and fatty liver are associated with inflammation and oxidative stress. Inflammation in the liver, as seen in NAFLD, can contribute to insulin resistance and the progression of diabetes. Impact of diabetes on liver health. Diabetes can increase the severity of liver disease in individuals with NAFLD. It is associated with a higher risk of developing non-alcoholic steatohepatitis, NASH, a more severe form of NAFLD that involves inflammation and liver damage. Impact of fatty liver on diabetes. NAFLD, especially when it progresses to NASH and cirrhosis, has been associated with an increased risk of developing type 2 diabetes. Management. Lifestyle modifications, including weight loss, a healthy diet, and regular physical activity, are crucial for managing both diabetes and fatty liver. Controlling blood sugar levels is important for individuals with diabetes to reduce the risk of complications, including liver-related complications. In some cases, medications may be prescribed to manage diabetes and, indirectly, to address aspects of fatty liver. The treatment of fatty liver involves lifestyle modifications and, in some cases, medications. It's important to note that the approach to treatment may vary based on the underlying cause of the fatty liver, e.g. non-alcoholic fatty liver disease or alcoholic fatty liver disease. Here are some general recommendations. Lifestyle modifications. Weight loss. Losing weight, if overweight or obese, is a key component of managing fatty liver. Even a modest weight loss, 5–10% of body weight, can lead to improvements in liver function. Healthy diet. Adopting a well-balanced and nutritious diet is crucial. This includes reducing the intake of saturated fats, refined sugars, and processed foods. A diet rich in fruits, vegetables, whole grains, and lean proteins is recommended. Physical activity. Regular exercise is beneficial for both weight management and overall health. Aim for at least 150 minutes of moderate intensity aerobic exercise per week. Controlling diabetes and insulin resistance. For individuals with diabetes or insulin resistance, proper management of blood sugar levels is essential. This may involve medications, lifestyle changes, or a combination of both. Avoiding alcohol. For individuals with alcoholic fatty liver disease, complete abstinence from alcohol is necessary to prevent further liver damage. Medications. In some cases, healthcare providers may prescribe medications to manage specific aspects of fatty liver disease. For example, insulin-sensitizing medications such as metformin may be used to improve insulin resistance. Statins or other medications may be prescribed to manage cholesterol levels. Vitamin E may be recommended for some individuals with non-alcoholic steatohepatitis, NASH, a more severe form of non-alcoholic fatty liver disease. Monitoring and follow-up. Regular monitoring of liver function, blood sugar levels, and other relevant parameters is important. Periodic follow-up with healthcare providers is necessary to assess progress and make adjustments to the treatment plan as needed. Treatment of underlying conditions. If fatty liver is associated with other underlying conditions such as high blood pressure or metabolic syndrome, these conditions should be appropriately managed. Thank you for tuning in to another episode of Diabtron. If you found today's content informative and engaging, don't forget to hit that like button and share it with others. Hit that subscribe button and join our growing Diabtron family. Don't forget to turn on notifications so you never miss an episode. Remember, your health is your priority, and with the right knowledge and community support, you're unstoppable. Until next time, stay healthy, stay happy, and keep thriving on Diabtron.